Hey folks, Justin from Tackle Tactics in the shed, talking tackle as we do. But today I have a special guest. I've got Ruth Logan from It's a Bloke Thing. Ruth, I like talking tackle. We talk tackle a lot in here, but you actually travel around the country talking to people about tackle.
I do. I tackle these blokes to talk about their tackle because, you know, men are such a shy little animal. They remind me of the platypus that you guys deal with. They don't want to talk to me much.
Yeah, you did mention platypus fishing lines because we are a bit like platypus, especially when it comes to this topic. So today we are talking tackle, but we are talking a little bit more specific in terms of tackle. So when we do talk prostate, not prostrate.
Yeah, we're not lying down to talk about this.
No, and I was one to do that, so I had a bit of a shocker there. You do find guys are reluctant to talk about it and that sort of thing. And for me, I was amazed by this guy. I definitely don't have one of those in my tackle box, and you guys probably don't either. But we actually do have one. I've never seen one, and I don't even know what it does.
Okay, rightio. Well, let's start at the very beginning, which is always a good place to start.
Yep.
And it's amazing how many men I talk to, Justin, who have no idea even why they need a prostate gland. Yep. So it's this little gland here that sits below the bladder, and the urine output tube goes right through the middle of it. And this is part of the pelvic floor region, which is really important when it comes to urine regulation. Yep. So this little prostate gland, I'll just take it out, is really intricate, and it's got quite, it's quite a detailed little thing, and it's quite problematic as you get older. When you're young, 20s or 30s, you wouldn't even know you've got a prostate gland, but you need one because it's part of the reproductive system. So you won't be fertile if you don't have a healthy prostate gland, which really doesn't matter if you're in your 60s and 70s and you've had your children.
Yes.
But when you're in your 30s and 40s and wanting to procreate, you need a healthy prostate. By the time you're 50, it's grown from about the size of a walnut to the size of a small plum. So it goes from about 20 grams to 40 grams. And by the time you're 80, it's doubled again. So it's a bit like a pear. Now, that can cause all sorts of problems for people. And it's not necessarily prostate cancer, but it's just an enlarged prostate, which can cause all sorts of urine flow problems and symptoms.
Yeah, so this is probably one of the most important pieces of tackle that you can talk about, and something that we need to get onto early.
That's right.
In terms of what this guy does, we know what it does now. We know that we've got one. What sort of tests and things are available? I know we all sort of feared this guy from just what I've heard, you know.
Right, and you've never had that test done.
Never,
probably. No. And there's a lot of blokes I find that are actually quite reluctant to go and have this conversation with their doctor about their prostate because they're fearful of that glove. A digital rectal examination is when they do insert a finger into the rectum to feel the prostate, okay? And a lot of doctors these days are not trained specifically to do that test, so they don't feel comfortable that they know what they're looking for, and they use technology like MRI and ultrasounds and scans and things instead. So if you've been frightened to go to the doctor because of that test, be prepared for it not to happen, because nowadays it's a simple blood test, and that's what the guidelines suggest, that you just have a blood test.
So when you were saying digital test, I was thinking, everything's digital now. But digital, we were talking.
These are digits. Yeah,
okay.
And it's amazing. You're not the first person that said that. These young guys think that they're going to have a probe up and some digital readout, but it's not. It's using your fingers to feel.
Yeah. And so nowadays, a simple blood test.
Yep. So the blood test that we have is the PSA test. PSA, not PSI.
Yep.
You were a bit worried about PSI, I think.
I'm at maximum PSI at the moment. I've got a few kegs to burn, so when you said PSI, I got worried. But PSA...
No, PSA is a blood test, and this is prostate-specific antigen, and it's a hormone produced by the prostate gland. Cool. So it's specific to the prostate. The biggest problem about this is that it's not specific for prostate cancer. So you can't just rely on that test to tell you whether or not you've got cancer. So if that does go up, and it's really about how quickly that's risen. So in my husband's case, he went from a 1.5 to a 3 in 12 months. And that 3 is probably still normal, because for a 50-year-old man, 2 to 3 is pretty normal. But the doctor said, oh, that's okay. which is what a lot of doctors do say, it's okay, and they don't actually tell you the number.
Yep.
And I said, well, what number is it? And they said 3. And I said, well, that's not okay because he's normally only 1.5.
Yes, yep.
So if it just goes up really slowly, which is what can happen with age, as that gland gets bigger, produces more of this hormone, and it'll just slowly change.
Yes.
But if it's a zip up and down, that's when you need to look at it.
Yep, like a lot of other things when it spikes.
That's right.
So that's measuring that level and seeing if we've got a spike or a rise.
That's right. And get a baseline, Justin. That's really important to know what your normal number is.
Yep. And is there an age where I should think about doing that?
Definitely. So when you're looking at having this test for prostate, the first thing you really need to understand is whether you've got a family history or not.
Yep.
So in my husband's case, his father had it, my father had it, my 2 brothers have had it. It's a very genetic predisposition.
Yes.
So it's critical that if there's any older men listening or watching this, that if you've had prostate cancer, please make sure you talk to your sons and your grandsons so that they know there's a family history.
Yes.
So it's really important to have that conversation. And a lot of blokes have been very shy about talking about this, and they're very sensitive about it.
I've never had this conversation with any of my family or anything. So
Haven't you?
I don't even know if there's a
family history
in our family.
No. And some people don't know their family history. So if you know your family history, or even if you don't know and you can't find out, the age to start testing is 40.
Yes.
Okay, so you should go to your doctor, and that's the next conversation, is to go to your doctor and say, I know I've got a family history, or I don't know if I've got a family history. I need to get my prostate checked. I need to get a baseline.
Yes.
If you know you haven't got a family history, and it's definite that there's no family history, the guidelines currently say 50 is the time you should go, and I believe that's pretty imminent for you.
Yes, so just around the corner for me, but regardless, from 40, it sounds like it's worth having a discussion.
And
with
some
doctor.
some doctors unfortunately won't test. Yep. And I've got a guy that was 41 when he was diagnosed, and his doctor, he really had to push him to get him tested, and he was diagnosed with a very aggressive cancer.
Yes, yep.
It's not just a disease of old blokes, and I think that's what we've got to remember.
And I think the thing for me is the realisation that it's only a simple blood test for starters.
That's right.
It's not going to take much of your time. It's not a big discomfort or anything like that.
It doesn't even hurt
to go and get it done.
And you can be getting it done when you have an annual health check. So the idea is that once you have your first test, you should go no longer than 2 yearly. And I think these guidelines are about to be reviewed, so it may even come back to an annual test.
Yep.
But Medicare pays for it once a year for you to have it done. And you can have it done when you have cholesterol and diabetes checks and all those things.
Yep.
But you need to have the conversation with your doctor. The doctor will not necessarily do that test unless you've talked about it.
Yeah, so this conversation is the starting point.
Absolutely.
And we go from there. And that regular testing then gives you that baseline number.
Yeah, and you can see what's happening. And there's all sorts of things. So this little book here is excellent, Justin, because what it does is it shows you the other reasons why that PSA can change.
Yep.
So it can change for all sorts of reasons. And sometimes it might just be as simple as an infection in the prostate.
Yep.
But you need to know what that result means.
And if the number is high,
Yep. Then they'll have further investigations. And usually it's a process of time. You'll have maybe a few months just to see what's happening, and then they can do all sorts of other tests, and eventually might have a biopsy if it is continuing to be high, and then from that they can tell if you've got cancer cells there and how aggressive that cancer might be.
Yep.
But there's lots of options, and the good news is that prostate cancer, if it's detected early and while it's still within the prostate, we've got a greater than 95% chance of you surviving.
That's amazing. It's like with a lot of things, get in early.
Yeah.
So get in early and get it checked out, and 95% fantastic. And I know there's the girls are excellent at it, and we probably need to drag the ladies in on this conversation about prostate cancer as well.
Absolutely.
Talk to your blokes and get it sorted, because you're so good about talking about breast cancer and that sort of thing. So how do the two kind of stack up? I don't want to compare them.
No. Well, when we talk about men and women, breast cancer is a cancer that is screened for. So we have 3 cancers: bowel cancer, breast cancer, and cervical cancer.
Yep.
So they're the only 3 cancers that we actually have a screening process for.
Yes.
So more women are diagnosed with breast cancer, but more men are dying from prostate cancer. And the reason being that a lot of blokes wait till they've got a problem before they go to the doctor. And I don't know if you know, Justin, but prostate cancer in the early stages, virtually every man who has early stage prostate cancer will not know he's got it. There's no signs or symptoms in the early stage. So if you're the sort of bloke that waits till you've got a problem before you go to the doctor, you might be waiting too long, and then if you have got prostate cancer, by the time you've got signs or symptoms, it could have spread outside of the prostate.
Yep. If you get out on the water and your reel's not working, or you get to the boat ramp and your boat won't start, you need to go and see the doctor. So all of us get in early.
Yep.
And
regular servicing and maintenance. I mean, you guys clean your boats, you're meticulous with your gear. I'm sure you spend a lot of time looking after all your fishing tackle. How about you look after your own personal tackle? Because we don't have spare parts. You can go and buy new lures and reels and lines and even a boat if you need to.
Yep.
But it's really hard to go and get a replacement prostate.
Invest a little bit of time in ourselves. And the ladies are so good with it in terms of breast cancer and talking about it and getting out there and getting tested and all that sort of thing. So let's see the blokes lift the numbers and see if we can save a few of each other, which I know you love. That's
save a mate, when we save a man's life. But 49 men every day in Australia are diagnosed with prostate cancer, which makes it the most commonly diagnosed cancer in Australian men. Unfortunately and very sadly, 9 men every day die from prostate cancer, and we want to change that statistic. So blokes, have those conversations, know your family history, talk to your doctor, have a check, make a date to check your prostate, and please know your number so that you know what's normal for you, and you can ask your doctor for the printout of that information.
Yep. So more information, where can people find some more information?
Look,
I know It's a Bloke Thing is the driver for you guys.
Yes, It's a Bloke Thing is a Toowoomba-born not-for-profit organisation that just raises money, and all the money that we raise goes to the Prostate Cancer Foundation of Australia, and PCFA, or Prostate Cancer Foundation Australia, have fabulous information, and they have a telehealth nursing service. So we also have 100 prostate cancer specialist nurses around Australia now, similar to what we have with breast cancer nurses. Not as many, but it's growing. But if you're a person that's got prostate problems and you're not close to a nurse, you can ring up the PCFA. There's a number on the back or on their website, and you can get to talk to your own personal nurse.
Magic. And we'll take a few details on the end of this video as well to give you a starting point, because realistically, we've all got the tackle box, we've got the tackle, and this is probably the most important tackle conversation that you've had if you get in there and have this conversation with your doctor.
Yep, thank you.
Ruth,
and thank you to Tackle Tactics. I can't believe what a great organisation it is for me to work with, because we're all talking about tackle, just different types of tackle.
Thanks for your time, Ruth. Awesome to have you here. A great message for people. Get out there, get checked early, have the conversation. All the best with the fishing.
Thanks, guys.